I'm Dr. Tammy Hayton, and I am part of Temecula Valley OB/GYN. I've been working here for almost 31 years. This is my first job right outside of training, and we've seen a lot of growth in the area, and I've been honored to do a lot of those deliveries, helping with our growth in our area, and very privileged to have the job, and I've seen the community grow and be part of that. When I was a child, I had congenital kidney problems. So I was in and out of hospitals and had multiple surgeries and this and that. And I think that probably was a foundational experience for me and making me wonder how the body worked and why I was there, what were they doing. And then as life went on, I became heavily involved in dance. And so when I went to college, I wasn't 100% sure if I wanted to be a ballerina or a doctor. And as life would have it, at the university that I went to, they had a policy. They didn't want to give out easy A's in dance, and they didn't want people taking dance who weren't serious about it. And I couldn't not have A's if I was going to go to medical school. And so one thing led to the other, and I ended up in the pre-med program. And shortly after starting medical school, I was giving tours in the medical center, and we stopped outside the NICU with the crowd and just looking at those tiny, tiny little humans and thinking about the miracle of life and the growth of a baby in a womb. And from then on out, I was full steam OB/GYN. I couldn't look left or right without coming back to this specialty of OB/GYN. I want to feel like I'm a team member with the patient. I'm not here to tell them what to do or how to do it. I'm here to share information. I like to think I'm able to empower my patients with information and help them make the best decision for themselves. And I don't want them to ever come to the gynecology appointment or obstetric appointment and be afraid. I want to help them through things that are awkward and fearful, and they're scared that can be painful, and help them through those moments and see that we're just on the same team getting done what needs to get done, and it can be an atraumatic experience. So I think that's one of my favorite things, is just educating and empowering women of all ages, girls of all ages, that's true joy of OB/GYN, is that partnership with the patient. I like to bake. I try to eat healthy, but I do like to bake, and sugar is always a problem. But I do like to bake bread, which depending on if you're carb phobic, that can be a problem too. But just yesterday I baked like the best focaccia, and that's basically what we had for dinner. I was late in a meeting and I didn't get to make anything else. I was home yesterday, and so by the time the meeting was over on Zoom, it was so late, and so we just cut into the focaccia, and that was dinner. And fortunately it was really yummy, but I don't know about being super healthy, but it was really yummy. So I enjoy that. I like to exercise. I'm fortunate enough to have a gym at home, and I enjoy doing that. And that's also my watching TV time. So that's when I get to stream shows and not feel guilty about it. And I enjoy boating. I enjoy being out on the water, and love being with my family, and very love to be involved with my church family as well. So
awesome. That's sweet. What church do you go to?
We're part of the Seventh-day Adventist Church.
Okay.
Yeah, we actually are members about an hour away from here. There's a big Adventist church up in Loma,
okay.
Yeah, my husband plays in the orchestra there.
Wow,
so
that's cool.
Yeah, we
cool.
go there.
Sweet, that's awesome.
Yeah.
Great, and then any last remarks that you would want possible patients watching this to know? Maybe you're trilingual, or I don't know.
I speak terrible Spanish, but I'm not shy about it, and I will do my best to get through an appointment in Spanish, and I love learning more Spanish at my appointments. I never took it in school. I took 5 years of French, against my dad's better wishes for me living in Southern California. But yeah, I love trying to speak Spanish, and I think for my patients, I just want them to not be afraid to come, and not be afraid of me, and just be there for them, and again, part of their team. I'm Dr. Tammy Hayton. I'm an OBGYN, part of Temecula Valley OB/GYN, and have been privileged to work here in this practice for almost 31 years, and look forward to working many more years here.